使命是不是高度的契合啊？那么它将和我们探讨如何落实我们健康生活的方式，从而延长健康寿命。
That's right, Jessie. So, our next speaker, his background as a medical oncologist and a certified oncology nutrition consultant has enabled him to combine medical care with personalized nutrition. His treatment philosophy perfectly aligns with USANA's mission.
大家把焦点放在舞台上大家想不想知道更多？那么我们要接住大家的双手 ，Put your hands together， 让我们隆重欢迎来自菲律宾的营级董事 Silver Director Dr. Alex 上台为大家分享。
Welcome, Dr. Alex.
Hi, good morning, guys. Hey, you've been sitting there for almost 1.5 hours. Why don't I invite you to stand up? Stand up, please, everybody. Move your legs. Move your legs. Stretch your shoulder. Yes. Stretch. Yes. Wow, very enthusiastic people here. Okay, sit down. Thank you. So our topic today is about lifespan versus health span. Many years ago, when I was still a young doctor in training, I was called to the emergency room because of a particularly difficult patient. When I entered the emergency room, 3 nurses were trying to pin down on the bed a 70-year-old man, while another doctor was trying to insert a tube into his throat so that he can continue to breathe. The patient fought with all of his strength and refused to open his mouth. And so the doctor failed. I know the patient. He's been in the emergency room 3 times in a span of 2 months. And because I am an expert at intubating patients, I yanked his jaw with a crushing pressure, with so much pain, and leave them with no choice but to open his mouth. In seconds, I was able to put in the tube into his throat. It was a howling success. For me, at that moment, I know that I lived by my mantra: nobody should die on my watch. But from the corner of my eyes, I can see the man's face streaming with tears, and he was shaking his head, and he looked at me with disgust. I can't forget that picture. That person has all the right reasons to refuse life-saving measures. He was diagnosed with an incurable stage 4 cancer, and he was in pain. Why am I telling you this story? It is because even today, in countless hospitals across the world, that attitude of doctors still continue, that we should keep the patient alive at all costs, even at the cost of suffering. And that brings us to our topic today on lifespan versus health span. And this is my disclaimer. We'll go back to that later on. I already told you my story. Today, according to the World Health Organization, majority of deaths are due to non-communicable diseases, such as heart attack and stroke, chronic lung diseases, cancer, which is my specialization, and diabetes. Now, all of these 4 diseases have 3 things in common. They are long-term diseases. They don't disappear overnight. They are mostly lifestyle-related. And thirdly, they can be prevented. Now, why is it that despite the many advances in medicine, we are still suffering from all these debilitating diseases? Mainly because of aging population, the lifestyle choices that we make, the food that we put into our stomach, and of course, even the cosmetics that we put on our skin. For sure, there has been a lot of increase in the lifespan as a result of modern medicine. But modern medicine brought with it a different set of problems. Because modern medicine is focused on treating diseases and not preventing them. People are living longer, but not living well. We prolong life, but along with it, we also prolong suffering. Healthcare costs that sink our life savings. Many of the people today suffering from chronic diseases are having limited mobility, where the only travel that they can do is the travel between the bed and the bathroom. Many people are suffering from cognitive decline, where their loved ones are suddenly strangers. Many people spend the last 20 years of their lives managing diseases rather than making memories. This leads to a longer but sicker life. People don't want to just have a long life. People are tired of being tired, living in their inflamed bodies, getting lost in their foggy minds, and taking so much pills that there is no more room in the stomach for food. People want youthful energy, strong immunity, mental clarity, independent mobility, emotional balance, and meaning and purpose. Imagine yourself as a 60-year-old with the energy of a 30-year-old. Imagine yourself as a 70-year-old still dancing, still traveling, still dreaming big dreams. Imagine yourself as an 80-year-old still doing TikTok. Imagine yourself as a 90-year-old dispensing your earnings to charity as Diamond Director. Would you like that? Yes. Now, as I mentioned earlier, medicine is obsessed with lifespan, making you live long, instead of focusing on health span, which is about how long you lived well. Think of lifespan as the number of years in your life, and health span as the amount of life in your years. Long life is a gift, for sure, but a healthy life is a choice. It is a disciplined choice shaped by the daily habits, the nutrition, environment, mindset, and yes, by the wellness products and the education you as USANA associates provide every single day as wellness ambassadors. Thank you. Now, let us talk about how do we actually build health span. I'm going to be talking about the pillars of health span, starting with nutrition and gut health. Food should be our default source of nutrients, but I just don't mean any food. It should be plant predominant whole foods and not processed foods from manufacturing plants. The recommendation is to eat 5 to 10 servings of fruits and vegetables daily, but studies show that only 1 in 4 people follow this recommendation. People don't eat fruits and vegetables with consistency and in the amount needed to keep our bodies healthy. Sure, people take photos of fruits and vegetables and post that in their Instagram. It doesn't help at all because people are obsessed with growing their followers instead of growing their health. They crave for likes in their Facebook rather than life. There is a warning in an English proverb that says, don't start digging your grave with your fork and knife. That is true. We are what we eat, as Austin mentioned earlier. Now, gut health is an important component of maintaining health span. And I'm not going to discuss this. This has been discussed by Austin and Dr. Catherine earlier. The second pillar of health span is exercise, but I would prefer to call it movement because it is easier for the brain to accept. You can run, you can walk, you can dance, you can do Tai Chi, you can do yoga. Guys, movement is medicine. Sitting there is the new smoking. If there are chain smokers, there are also chain sitters. Remember, even simple daily movement dramatically impacts aging. Just doing 30 minutes of exercise daily for 5 days can already reduce the risk of colon cancer recurring by 28%. The American Cancer Society said that exercise is linked with lower risk of 13 types of cancer. You don't even have to go to the gym, guys. You just have to walk or jog for 30 minutes daily for 5 days. The third pillar of health span is sleep. And sleep is something we cut to accommodate our busy lives. Sleep is not a luxury. It is the body's nightly schedule to repair and regenerate. And yet we treat sleep like our credit card. We incur sleep debt from Monday to Friday, and then we pay back during the weekends by oversleeping. Guys, it doesn't work that way. Lack of sleep leads to a lot of these neuropsychiatric disorders, including Alzheimer's disease, anxiety, depression, bipolar disorders, suicide and stroke, and many of these diseases like cancer, diabetes, obesity, etc. When sleep is good, everything improves. Your hormones, your mood, your immunity, your blood sugar control and metabolism. Sleep is also one of the best anti-aging protocols. The fourth pillar is to maintain healthy and normal weight. Obesity now is a global epidemic. And in 2022, the WHO said 13% of the world population is obese. That's 650 million people who are obese. And the number is increasing even in the teenage years and the young adults. And we know that obesity is linked to many health conditions: heart disease and hypertension, diabetes, cancer, fatty liver, and in women it is associated with infertility, PCOS, and difficult pregnancy. And the fifth pillar is stress management. Guys, stress makes you age faster than your birthdays do. Stress doesn't kill you fast. It just keeps you alive long enough to pay hospital bills. I don't want to talk too much about stress, because if stress was a course in the university, all of you will be candidates for PhD in stress, because we all experience it in a daily basis. We have come to regard it as the new normal. Many of us live lives of quiet desperation, and we don't have to do that. The last pillar is purpose and meaning. Guys, are you familiar with the blue zones? Yes? Yeah. In the world's blue zones, life purpose has always played a major role in the well-being and the long lives of residents in these zones. The Okinawans from Japan call it ikigai, the reason for being. For me, I found a renewed purpose in my life when I realized that being an oncologist is not just about pushing chemotherapy drugs, but about spending time and educating the patients about the importance of changing their lifestyle, maintaining mental health. That gives me so much joy, aside from pushing chemotherapy. My question to you is, what gives your life meaning and purpose? How do you connect it to your USANA business? We are in the midst of a wellness revolution. We are not just entrepreneurs selling supplements. We are part of a global movement shifting the world from its focus on disease to wellness. We are helping people take control of their health, not someday, but today. I hope I was able to convince you about these different pillars of health span and how does that connect? How does this connect to the products that we have in USANA? And I have to be very careful about this. And it brings me back to that disclaimer that USANA products are not meant to diagnose, to prevent, and to treat medical conditions. That is very clear. However, we know that certain products are important foundation for good nutrition. Essentials, for example. Fiber G and probiotics are important for gut health. For you to be able to execute movement, you must have good bones, good joints, and strong muscles. You connect the dots. What are the products that can give you those? I'm not going to mention them because you studied nutrition after all. Sleep. We do have some products to make the clients have a long and relaxing sleep. And of course, we have products to help with stress management, including oxidative stress. So these are the 6 pillars of health span. But wait, there's one more. And the most important pillar of all is you. Because we can talk about all of these concepts in our heads, but if they just stay in our heads, we wasted our time today. What we need you to do as graduates of the Regional Wellness Coach Program is to go out there and to become foot soldiers for Dr. Wynn's vision to build the healthiest families on earth. With that, thank you so much.
Thank you, Dr. Alex, for your wonderful sharing.
我们感谢 Dr. Alex 带来的这个精彩的分享。我想请各位大家一起来思考哈，我们来动。